Spedra, avanafil, is a relatively new drug in the treatment of erectile dysfunction, ED, receiving FDA approval in 2012. It's often seen as a new kid on the block in comparison to other more well-known medications like Viagra, sildenafil, Cialis, tadalafil, and Levitra, vardenafil. Here's a breakdown of its pros and cons. Pros of Spedra, avanafil. Quick onset of action. Spedra is known for its rapid onset of action, usually taking effect in 15 to 30 minutes. This is much faster than some other ED medications, such as Viagra, which can take 30–60 minutes. Shorter duration of action. While it works quickly, it also leaves the system faster. Its effects typically last about 4 to 6 hours, which is shorter than some competitors like Cialis, which can last up to 36 hours. Selective action. Spedra is more selective for the PDE5 enzyme in the body, which might reduce the likelihood of side effects compared to other ED medications. Lower risk of side effects. Due to its selective nature and rapid action, Spedra is reported to have a lower incidence of side effects compared to older ED medications, such as headaches or facial flushing. Less food interaction. Spedra can be taken with or without food, unlike Viagra and Levitra, which can be affected by heavy meals. This makes it more convenient for spontaneous use. Well tolerated. Many users report that Spedra is well tolerated compared to other ED drugs, particularly for those who have had negative experiences with older medications. Cons of Spedra, avanafil. Limited availability. Spedra is not as widely available as Viagra, Cialis, or Levitra. Some people may have difficulty obtaining it or may not be covered by insurance plans. Relatively new drug. Being a newer drug, Spedra may not have the long-term data that older medications like Viagra have in terms of safety and effectiveness over extended periods of use. Not suitable for everyone. Like other PDE5 inhibitors, Spedra should not be taken with nitrates, used for chest pain, or by individuals with certain heart conditions or low blood pressure. Therefore, its use is still restricted in specific patient populations. Potential for side effects. Although Spedra tends to have fewer side effects, there can still be adverse effects such as headaches, back pain, dizziness, nasal congestion, and flushing, which are similar to those seen with other ED drugs. Cost. Being a newer treatment, Spedra may be more expensive compared to generic versions of older ED drugs, making it less accessible for some patients. Less long-term effect. For those seeking a drug with longer-lasting effects, Spedra's shorter action time may be a downside compared to Cialis, which provides more extended relief and is even marketed for daily use. Just before we conclude, please remember to hit the subscribe button for more videos. Spedra stands out for its quick action, fewer side effects, and convenience, can be taken with or without food, making it a good option for many men with ED. However, its shorter duration, limited availability, and cost could be factors to consider. It may work best for those who need quick, intermittent relief rather than a long-lasting solution. Always consult a healthcare provider to see if Spedra is the right fit for your specific needs.